Hello, this is Joe Gagliardi, President and CEO of the Greater Folsom Partnership, which includes the Folsom Chamber of Commerce. Through these organizations, we are pleased to present 2 weeks of targeted content to assist our business community. Since 1946, the Chamber has led the way for Folsom's prosperity and solid growth. In these challenging times, we are leading the way to collectively build the skills and competencies we all need to navigate the changes of 2020. This is a two-part effort including daily webinars and podcasts, which will capture the topics that are top of mind for our members and partners. The webinar will be available on scheduled days at 9 a.m. via the Zoom platform. The audio podcast, like this one, will be posted daily on our YouTube channel by 8 a.m. We are excited to blend the collective knowledge of the local business scene and the entrepreneurial skills of our partners at Tribe and Granite City Co-working. We are co-creating content to keep your business on the forefront of what you need to make critical pivots and lay the groundwork for successful following this tough stretch. Details about the schedule and content can be found on folsomchamber.com.
Hi, this is Marianne McAuley with the Greater Folsom Partnership. Today I have the opportunity to interview Dr. Stephanie Parmley. Dr. Parmley is a psychologist affiliated with the Dignity Health System. She has a practice that includes children's, families, and adults. And we're here today to talk a little bit about the mental health implications of this COVID crisis and all that has gone with it for so many people in our community. Thanks for being here today, Dr. Parmley.
Thank you for having me.
So I'm sure you're spending a lot of time with a variety of clients and just within your own healthcare system discussing this issue. But of course, for those of us that are affiliated with the business community, we are seeing a lot of fear, and that does seem to be a challenge that a lot of people are trying to come to terms with so they can make good decisions. And tell me a little bit about some of the best practices you're recommending for dealing with the fear that goes along with this kind of situation.
Well, I think anytime there's a totally new situation that's unprecedented like this, there's a lot of unknowns. There's a lot of unknowns, not just because we don't know who could get. I mean, we know a little bit about who could get sick and who could be more at risk, but we don't know a lot about how long this is going to last. We don't know if we're really going to catch the curve before it gets worse. We don't know about our jobs. We don't know about what's going to happen to our kids with school. How are they going to do? There's a lot of unknowns, and we don't have anything to look at that's been in our history to be able to have as a backdrop to help us understand. We've had crises in the past where there's been depressions. We've had, people die from pandemics, but we've never had a lot of these things combined on top of the social isolation and pretty much a forced recession because of the need for self-sheltering. Anyway, so that being said, as far as mental health goes, I think it's really important that people be able to talk about whatever they're feeling and experiencing during this time. A lot of people have different opinions about it. There's very strong opinions about the importance of staying home. There's a lot of people that have feelings about, I wish we didn't have to stay at home, and all those in between. And I think it's important that we have listening ears for people to express whatever they're feeling and validate whatever people are feeling. And for people to have somebody that they can talk to that they don't feel is going to judge them for whatever their experience is. As far as the anxiety goes, which is totally understandable for people not knowing about their jobs. My husband works in an organization that just last Wednesday, they furloughed or fired 50% of his workforce. And that's pretty scary. He works with restaurants, so there's a lot of restaurants that are suffering right now. And so I'm sure that a lot of people in hospitality are really concerned and worried, and especially when there's a backlog of unemployment, there's a lot of unknowns, there's a lot of anxiety. And I think that, in this time, I think it's really important that we can only do what we can do. And when we need to rely on family members for support, hold on just a second. And, I can't talk on the phone right now, honey. I can't help you with this right now. Sorry.
That's okay. As we talked about before the call, this is the new norm, so everybody gets it.
Yes. I have 2 kids at home. I have a 9-year-old and a 6-year-old. And my 9-year-old right now is trying to do some math homework on the computer. That is correct.
We're
So,
going to have a lot of adults who've had a serious math refresher when this is
oh
all
my
over.
gosh, yes. So, so I was saying about anxiety. So it's important to have support. It's important to have people you can talk to. And luckily, I mean, luckily, very very luckily, there is a very fast, very speedy push that's been made to get telehealth online for mental health. For a long time, California has been working on this, and now we're like streamlining it, like fast to get people the help that they need, via either telephone or via computer, Skype, all those kinds of things. So I think that if there's a possibility of somebody needing mental health care, they can do it via telephone and they can do it via computer telehealth means right now if they can't get to see somebody.
That
Um,
sounds like really one of the silver linings in this whole situation, because I think that will be a lifeline for so many people.
hmm And one of the things that I recommend a lot with my patients, as far as dealing with anxiety goes, is there are some really important. I mean, there's a lot to be said for this crisis that could be helpful. Obviously, not losing your job isn't helpful. Losing somebody to the COVID virus is not helpful. But for people that are not in that boat, there are things that are helpful about this. There's a forced relaxation to some extent that we all have to do. We all have to kind of um, pull inward, and whether that means that we spend more time with our families or we spend more time with our home, cleaning it, organizing it, whatever, relaxing, not having structure. There's only so much not structure that's good for us, but when we don't have structure, there's some benefits that we can take from that, as long as we try to be mindful of appreciating the small things. And so, a lot of what I do with my patients is trying to encourage mindful based practices. And mindful based practices are really, really simple and easy to learn. There's lots of online YouTube examples of how to do this. But the benefit for people's anxiety and depression, which is undoubtedly what's going to be happening for a lot of us right now, what it does is it helps increase um, the activation of the frontal lobe. And the frontal lobe is the part of the brain that helps reduce the impact of negative emotions. And so when you focus on one thing at a time, whether it's focused breathing or focusing on coloring, like adult coloring books, for example, when you're tuning out thinking about the past and the future, you're giving your frontal lobe exercise, which helps to reduce the impact of depression and anxiety. So that's one thing that's really helpful.
And there are some great online resources for people that are being introduced to a mindfulness practice. And
Mm-hmm.
I think it's fascinating that there is such a strong correlation to the science of it. So this is
Mm-hmm.
more than just a feel good, right? This is actually a very positive thing you can do for yourself during this time, and maybe even cultivate a lifelong practice starting
Absolutely.
now.
Yeah, absolutely. There's so much brain science on what we can do um, through our focused attention, and especially through our eyes. There's a lot of, like, for example, brain spotting is a treatment approach that has a lot of evidence in neuroscience on how, when we look at certain objects in our sight line, that it can help us deal with negative traumas, negative past, current anxieties, especially with this going on. So, and in fact, I've been getting some training recently on brain spotting, where we can do it remotely with people via Zoom. We can even do it via telephone. There's a lot of really helpful things. For example, one thing that comes out of the neuroscience is, and actually not just neuroscience, but body science, for lack of a better phrase, is that when we focus our gaze on something far away, like let's say outside, like if you're near a window and you could focus on something outside, like a tree, a spot on that tree, and then you pull your gaze inward to somewhere close, maybe 2 or 3 feet away, and you alternate back and forth about every 7 seconds, that working of the eye muscles actually helps the vagal nerve calm us down. So there's a lot of things that we can do kind of in a moment when we need to reduce our anxiety. I mean, it's not going to take care of the cognitive and true life behavioral things that are going on that make us anxious, but it can help reduce some of the feeling of anxiety sometimes if we need it.
That sounds like such a great strategy. Easy to learn and easy to use once you've
Mm-hmm.
practiced.
Mm-hmm. Absolutely.
So a lot of people, I think, are, there's what's happening globally,
Mm-hmm.
regionally, but then as you pointed out in this conversation, a lot of people are living a new norm at home where they're spending a lot of time with family, which can be good but also challenging. So do you have any strategies for people to weather that whole piece a little bit better? Speaking from personal experience, obviously.
Oh my gosh. Yeah, yeah. I mean, the one benefit I have working for me right now is that my husband and I are not in the same place 24/7 like probably some couples are, because at least he's out still working. Um 4 days a week, but I mainly do telephone calls with people, so I'm not really interacting with people much. But when I am home, and my kids are home 24/7 for the most part because they're not in school, as most California schools have closed down. Um, there's a lot. there's I hate to say this is not a good coping skill, but there's probably a little bit more drinking that goes on in the evening in my household, and maybe other people too.
Oh, from what I see on social media, I think that is a definite trend. Yes.
Yeah, because when you're wrangling children, and my children are older, but still they're around each other 24/7 now, whereas before they were not. it's it's interesting. It's trying to set a structure, and I don't know if people feel this way around other relatives, but definitely I think when families have their children home 24/7, it can be an added stressor. And the benefit that I can say about living in a neighborhood, a cul-de-sac where we live, is that we've kind of included our neighbors into our quarantine group. So we've alternated going back and forth with our children going to their house for a little bit, their kid coming to our house for a little bit, and and that sort of helps, because at least they have another distraction. We do a lot of running, bike riding, walking, playing outside as much as possible to kind of wear each other out. Lots of board games, lots of coloring and drawing, and I think the one big thing I would say as a parent that I think is important when you're home with your children as often as we all probably are these days is we really as parents have to be careful to be off social media or telephones or television, and not just because of the content of what we see. Obviously, there's a lot of scary stuff when you turn on the news, but just the fact that our kids are so easily gravitate toward media, that if we're trying to keep them occupied, we don't want to ourselves be modeling behavior where we're on the phone a lot or we're in front of the computer a lot. So with me, I try very hard to not be on my phone. I try to be reading a book if I ever can. or or playing games with them, or sitting at the table, drawing, coloring, doing something to model that behavior, and then they're less likely to want to push for being on the media. And I think when kids are at home 24/7, that's what they gravitate to. And I'm not going to say it's terrible. I mean, there's a lot of kids that play video games, and if they do it in short doses, I don't think it's terrible, but it's so it's such a habit that can be addictive, and it makes kids more irritable when they don't get that opportunity. And when they're in
Right.
school, they don't have as much time to do that. So when they're home 24/7, it's much easier for them to get on those devices and games. And so that's the one thing I would say to people that are home with their kids 24/7 is to, as much as possible, be engaged with them, doing things with them, family activities, because those have some element of structure to them. And
Right.
and kids really like to be with their parents, even though they get angry and frustrated with them. They really do, especially if they can't be with their friends.
My children are grown now, but I remember one of the rules I learned early on that I always subscribe to, and that is it's much more important to focus on what you do than on what you say, because what kids really pay
Mhm.
attention to is, as you said, the behavior that we're
Mhm.
modeling for them. So I think that's great advice. Let's talk for a minute about social media, because even for adults, Yeah, in your earlier comment, you talked about being able to talk to someone who doesn't judge, and I was reflecting on that because I've seen a lot of people posting about feeling pressure from, for example, the person who uses this time to be super productive, because maybe not everybody can do that, right? They're dealing with how
Sure.
they're feeling first, and then conversely, you have, the reverse point of view. So, talk a little bit about social and maybe some best practice about how we interact on social media, which is it's an important tool right now for sharing
Oh yeah.
information, right? So,
Absolutely. Absolutely. And so, when I say, reducing time on social media when you're around your kids, I of course, as adults, we still have to have contact with people when we can't talk to our family or friends directly like we used to. So I think that in limited amounts, I think it's important, or if we involve the kids in it. So like if we're doing a phone FaceTime with like a relative that we can't talk to, because they're confined to a senior care facility or something like that. I think that those things are really important, um, because I think we need to reach out to family and friends that we can't talk to, not only for ourselves, but for them, to be able to keep that contact. It makes us feel like we're not alone, it makes them feel like they're not alone. Um, and I think that as much as possible, I think that it's better to do that via actual telephone calls and actual FaceTime calls and actual maybe even letter writing. It's kind of like a lost art. And instead of just going on to Facebook and saying comments on people's things. I mean, there's nothing wrong with that, but it's not the same as actually having a conversation when we really need it most at this time.
that's a great suggestion. I love that. And some of our team members have had their children writing letters, and you're right, it is a lost art, and maybe one that's worth
Mhm.
resurrecting, right? So
Mhm.
another silver lining. What do you recommend for people that have never worked at home? I think on such a consistent basis, even even in a scenario where they don't have a family, but they're just used to being in a more traditional work scenario. Any best practices there that you think help from a mental health standpoint?
Yeah, I think as much as possible. To be honest, I know people that do work at home as a regular part of their careers, they tend to work longer hours than people that go to an office because there's never a clock that says you have to stop now. So the risk of people working at home during this time when they were used to working in an office is that there's a possibility that they may work longer hours. So I think it's really important to keep a structure of the hours that you work and like have a regular standard time that you start. I would say it's really important for our mental health to continue to get up around the same time because our circadian rhythms really are affected by when we get up and first see light for the next 24 hours. It can affect when we get sleepy at night. So I think for us it's important to keep a similar structure of going to bed at a similar time approximately and getting up at a similar time, getting dressed, exercising, and when you do have to work at home, I think it's important to have a similar type of day where you go to work at, if you go to the office at 8, you start your day at your home at 8. And then you definitely take breaks and have a lunch break. I mean, that's the bonus is you get to actually take a lunch break. I know for me, I rarely take lunch breaks at work. Um, and that's a possibility that when you work from home you may not take it because you could just keep working, but it's really important to do that and to have a time where you cut off, where you're done with your work. There's always work to do, but if you have a time where you say, okay, I'm done, now is my downtime. And I notice too that sometimes when we work from home there may be a particular place that you work that you think is good and quiet, but it may not be the best place for your mental health, like working in an office in your house that's maybe not got a lot of sunlight or feels kind of closed in. Bring, if you have the ability to do it, bring your computer or your laptop or your papers or whatever you have to do up to an area that feels more open, that's got more sunlight. That really does make a difference. Or even if you can sit outside when the weather's good, I think that's a lot better than working in an office all day inside your home.
Absolutely. And once again, the ability to go outside easily is another silver lining of the work from home. So to take advantage of that while it's available is a good thing.
Yeah, and I do want to say too that I think one of the things that we can still do is exercise. And during this time, exercise is better than an antidepressant. In a lot of studies that they've done comparing people that exercise regularly who were depressed with people that didn't and took antidepressants, the people that continued that did exercise actually showed the same benefits as people that took antidepressants. So I think it's really important to make sure that during this time, as a way to reduce anxiety and depression, that people continue some form of exercise. And when the weather's not good, you can't get outside, but there's plenty of YouTube videos that are super diverse on different amounts of time, different types of exercises, low impact, high impact. For people that can't do a lot of impact, there's chair exercises, there's all kinds of things.
So important right now, especially since many people are spending hours every day in a chair in front of a screen. So I think there's lots of opportunities there. Well, I think that it's pretty clear that the strategies you're talking about today should become a high priority for a lot of listeners who are really concerned for their well-being, their mental and physical well-being, for families, for themselves as individuals. Is there anything else that I didn't ask you about that you wanted to comment on today?
It's hard when I don't. It's hard because I'm such a person that likes to work individually with people. So when I have like an individual that has specific concerns, for me, I really like to come up with ideas based on what their interests are to help them specifically. So it's hard when it's like such a diverse amount of potential issues that people have
Sure.
right now.
Well,
Go ahead.
I think you started the conversation, though. So maybe for people that, what is your best practice here? If someone feels that they need more assistance in dealing with mental wellness, what do you recommend?
I definitely think that it's probably very normal for people to feel down, for people to feel anxious during this time. I think that as an individual, if you feel like your daily routines, or this is the difference between just normal societal anxiety and something that needs mental health treatment. I think that if you're feeling down, having trouble sleeping, your eating habits have changed significantly. And I don't just mean that you're eating more comfort food because it's a difficult time, but I'm saying, you really don't feel the need to eat as much, or you're eating excessively. You're feeling like your life isn't as meaningful. You're not finding enjoyment in things you used to do. All of these things could be very normal during this time, but for you, for as an individual, if they're feeling those symptoms for more days of the week than not, for at least 2 weeks, that would be a good reason to actually get a referral to a mental health therapist or to their doctor. And for anxiety, I would say that if people are having a really hard time, same thing, kind of difficulty sleeping, their mind is ruminating all the time, they can't get certain things off their mind. For more than 2 weeks, I would definitely say the same thing. It's important to seek mental health counseling. For some people, this could bring up old traumas, of feeling trapped, of people getting seriously hurt or injured, hospitalization. So there's a lot of different things that could come up for people during this time, and so I would say that it's important to seek mental health counseling or a doctor referral if you can. And I know that's really challenging during this time because sometimes it's hard to get in as a new patient via telehealth. So I don't know, to be honest with you, how difficult or hard that would be for somebody who's a new patient, but you can at least make the phone call to like with Dignity Health, we have a behavioral health line where people can make phone calls for getting a referral. And I'm sure that people could still call their doctors at this time and get a referral if they need to. I know that they're really loosening the restrictions on telehealth, so if somebody is in desperate need for something, they could get they could call their doctor and get a referral for possibly medication or therapy.
Those are all great tips, and good to know about the movement on telehealth. I'm sure that's going to make it accessible to so many people. I appreciate all your insight today, and I've learned a lot. And personally, I'm on my way now to look up brain spotting and see if I can learn more. So great tips. Thanks, Dr.
Thank
Parmley,
you
for being here, and stay safe and well, you and your family. I look forward to talking to you again.
Thank you so much. It was good to talk to you.
All right. Bye-bye.
Bye-bye.
Well, thank you for joining us today for this podcast, Daily Drop, Local Knowledge to Start Your Day. You can check out the full schedule of upcoming speakers on folsomchamber.com. Follow us on our Facebook and Instagram platforms for more resources and links to support your business decisions in the upcoming weeks. Email us at teamrecovery@folsompartners.com with your individual questions. We are proud to be part of the great community of Folsom. Stay safe and well, and Folsom stronger together.